Since the GST has come, there has always been debates with respect to something or the other, as in under what percentage of GST taxation do they lie. Okay, so for example, certain things which should be not taxed or taxed at a lower rate, if they are being taxed at a higher rate, so that's a problem. So many such goods were there previously also, and this will be refined further and further as we keep on refining the list of GST. But every now and then certain issues keep on coming. So one such issue that we are dealing with right now is the GST on health and life insurance in India. Now, we know that the penetration of health and life insurance in India is very low. It is very low. Now, when I am saying very low, it is not very low with respect to a developing country, but what we aspire to. We aspire to be a developed country, developed economy, right? A superpower. At the same time, we aspire to have full-fledged, complete, comprehensive 100% life insurance penetration, life and health insurance penetration. So we are very far away from that, and that would be a good thing once we achieve it. But right now, as we stand, we are, with respect to penetration, we are very low. Now, even after that, why this particular thing is in news? It is in news because since we are at a low level of penetration for insurance, we should facilitate people to take life insurance. And the government has come up with various schemes also, especially big schemes in the agriculture sector. So in agriculture sector, you have life insurance scheme, sorry, not life insurance, but crop insurance scheme. So there the government pays the entire premium except for small percentage, right? So that is what Rabi crops are there, Kharif crops are there, and horticultural crops are there. So for Rabi crops, the farmer has to pay only 2% of the total premium. Kharif crop only 3% of the total premium. Horticulture crop only 5% of the total premium. So here also the government wants to increase the penetration of insurance, crop insurance. So they have come up with crop insurance scheme wherein only such a small amount is to be paid. Now this is specially for the farmers for their crops. When it comes to life insurance, health insurance, now this can be for farmers as well, and this will be for everyone in the country. Now here also, if the penetration is low, ideally what you should do is encourage or facilitate people to take that up. How you could do that? By bringing it various schemes, and the government has done that also. Government has brought various Suraksha Bima Yojana, Pradhan Mantri Suraksha Bima Yojana, other life insurance schemes, various schemes have come. So through government schemes you can take the benefit, but many people like to go, do go for private insurance also. In fact, there is also Ayushman Bharat, which is a very good scheme, right? In short, it's a health insurance up to 5 lakhs every year, right? So this is also there. But in addition to that, many people also go with private life insurance, private health insurance. So what is the issue here? Why is it in news? It is in news because the insurance premiums are coming under the 18% GST slab. 18% GST slab. Just above this 18% GST slab is the 28% slab of sin goods. So just below sin goods is your life insurance premium. And that is why this is being criticized. Especially, of course, you will have what? Opposition party is also criticizing, and from various other quarters, it's not just about politicizing the issue, various other quarters also it is being criticized that 18% GST on insurance premium is too high. If you want to increase the ambit of insurance, you need to lower the GST on insurance premium, right? So that is why this particular thing is in news. So now let us understand what is the current state of health expenditure in India. So expenditure has increased over the years, but it has not increased up to the level we would want it to increase. Okay, so it has been under scrutiny, of course. It has increased, as I said, expenditure, but not up to the level. That's point number one. Point number two is, when you talk about inflation, inflation is general increase in the price level for a sustained period of time for a basket of goods and services. Now in this basket, food items will be there, power, energy items would be there, durable goods. In the same manner, this basket also has certain medical related equipment, services, etc. So if you would look at just this medical related thing, the inflation in medical sector, which you could call it as medical inflation, is estimated to be around 14%, which is quite high. What do you mean by 14%? Meaning, if in 2022 you could get something for, let's say, 1000 rupees, in 2023 you would get the same thing in 1114 rupees. So 114 rupees increase on 1000. No, sorry, not 1114. I should do the math carefully here. It would be 1140. So that's a 140 rupees increase over 1000 rupees. That means it's a 14% increase. So it's a high inflation. Just compare it with the inflation targeting which RBI does with the help of monetary policy. That is 4 plus minus 2%. So it should range between 2 to 6%. Now 6% is the maximum limit. It is more than double of that. So even inflation is higher. The other peculiar thing that India faces, like other developing country, is a very high percentage of out of pocket expenditure. Now what is out of pocket expenditure? See, what happens generally is, generally when you are working in an MNC and all, everything is insured, you are also insured, or you get your own insurance. So if you are sick, you go to the doctor, you go to a hospital, they check you, they give you medicines. So, I was working in L&T, I had my insurance, so I fell sick one fine day, not a fine day of course. I went to the hospital, they checked me, and I asked for the bill and all that. So the not the doctors but the assistants over there said, sir, if you get admitted, so the bill was quite high because the medicine was I think costly and few procedure and check and all they have to do. So the bill was some 3K or something, it's 10 years ago. So what they did is, they said, sir, if you get admitted even for just one single day, it will be covered in your insurance and you don't have to pay that and you can stay here tonight in our room. Now, when I get admitted, I stay for a day, that may go up to 7,000-8,000. But I won't have to pay because that will be covered, right? What do we mean by this? By this we mean that this insurance, generally these insurance that are there, they will cover certain ailments, certain issues, and only when you are admitted in the hospital for a minimum one day, then only it kicks in. If you are not well, just go for a checkup to a general physician or to any doctor, get it checked, get the medicine, and there was no need for you to be admitted. Then in majority of, in fact in almost all of the insurance cases, you will have to pay, you will not be insured. And that expenditure which you are doing on your medical bill is the out of pocket expenditure, because then and there you take it out of your pocket and give it. So any such expenditure is called as out of pocket expenditure, be it on medical or something else. So out of pocket expenditure in India is still high, which is close to 40%. So all the expenditure that is happening on big operations, transplants, this, that, all that, and all people getting admitted and everything amounts for just 60%. Of course, this is more than 50, but still, imagine operations of 10 lakh, 50 lakh, 70 lakh crores of rupees, still it amounts to this because the number would be less. But here, you're going, getting it checked, 500, 600 rupees, 1000 rupees per visit, all that is amounting to 40%. So this is still quite a high number. Okay, so that is one issue and it is not covered, and because of it, especially for the poor people, they would not have the money, even 500 rupees to get it checked. So all these problems we are facing. In fact, they give an example of Uttar Pradesh state where the out of pocket expenditure is exorbitant, 71.3%. Okay, further, of course, the expenditure that we are doing has increased. The expenditure with respect to GDP, the expenditure with respect to per capita has increased, but still, total expenditure is 3.27% of the GDP and amounts for rupees 4,863 per capita. Now, if you look at countries like USA, they spend 18% of their GDP Also remember their GDP is also more, and an increased percentage of that GDP they are spending. So they are spending more amount, point number 1. Point number 2, their population is less. So per capita would be even higher. So the difference is a lot over here. Okay. So why is there a need to reduce? All these things we discuss are basically giving us the reason to reduce GST on the insurance premium. But let us still look at it. Insurance, a basic necessity. Of course, if you don't have insurance, even a middle class, lower middle class, upper middle class family can come into poverty. Imagine a middle class family, a working person is there, only one working person, and maybe 3-4 total members are there. That person requires a surgery. You don't have much savings. You sell off everything, do their surgery, and they are still handicapped or can't work. Now what do? No source of income. Savings are gone. Everything is gone. Poverty can strike in, right? That is there. Affordability. It is going to make things costlier, of course. Global comparison, if you look at it, then global comparison, as per global comparison, the taxes are high. They have compared it with countries like Singapore and Hong Kong. They do not impose such taxes on insurance, right? Impact of insurance penetration. Impact is also good. Why? Because when things are insured, you are ensuring, when a poor person, for example, or even person who might be middle class or whatever, when they are insured, they don't have to spend. It is insured with the pool of money that is being given as premium. It is insured. So our other aim is to reduce poverty. So we will ensure that there is no poverty. We will ensure that deaths are less. We will ensure that people get the services. If you're not insured, you don't have the money, you can't do the operation. So all those things would be addressed, right? Further, lowering the GST, of course, it could encourage the people to purchase insurance. So insurance for all goal of 2047, that is after 100 years of our independence, the goal is that everyone is insured. We will move towards that as well. Economic growth, right? What happens is insurance sector growth would be restricted. Why? When the rate is high, less number of people would want it. So the growth would be also stuck. So all these benefits are there, which tells us why we should lower it. But there is a flip side. If we lower the GST on insurance, what will happen? The government would want to collect that revenue from somewhere else. Because of it, first, the revenue of the government can go down. If the government wants to maintain that revenue, then that would lead to increase on burden other taxpayers, increase of burden on other taxpayers. Somewhere else they have to tax. So that is one thing, right? And of course, when you remove the GST, it may lower the cost of consumers, right? But the healthcare providers might increase the cost. Okay, so see what happens is, if a product is of 100 rupees, 10 rupees is GST, and let's say the government removes this GST, now the product is of 90 rupees. So the provider will say, okay, anyhow it was 100, this 10 rupees has been removed by the government, let me take the advantage of that 10 rupees removal and let me keep it 100 rupees only. So the health provider may not transfer that benefit to the client or the consumer. That is another issue which can happen. So what is the way forward? The way forward is, of course, there needs to be a GST review of medical sector and also of the other products and services, goods and services in the list. At the same time, more capital support. Of course, capital support is there, but we need more of it and more public investment in the healthcare. We saw we are investing only 3.27% of GDP, and other countries are doing high, so we need to change that as well. And various other policy reform, one of which can be prevention is better than cure. And these policies are subtle. Just imagine we have International Yoga Day celebrated, right? And we are the ones who has initiated that. Now it is celebrated all over the world. So if we start doing exercise, start doing yoga, for example, start doing other things, other exercises which keeps us healthy, all those things. Now this does not require money, anyone can do that, right? At the same time, even the people who are poor, even to that, the government is giving trying to give food through the National Food Security Act, coming up with so many things, creating awareness of the importance of yoga, creating awareness of the importance of exercise. All these things would ensure that our health is also better. So we need less and less of medical attention and care. But no matter how much you do, you may still require it. So hence, the point again comes for your insurance sector, and revisiting the insurance percentages could be the way forward. Thank you.